Hi there, and thank you for joining Prepping for the Digital Workflow. My name is Dr. Lori Trost, and I will be your presenter for this program. And to kick off the new year, I just want to wish everyone a happy new year. And with that said, a lot of times it is definitely a new start. And being in January, as you look forward, it's never been a better time to set goals for your practice, both personally, professionally, for your teammates, for your equipment lists, for all those kind of products and materials that you want to introduce, maybe new procedures. So I really encourage you to map out the year and really look at what's possible, because I think that's how we all grow and we get better. But the bottom line is I really want to roll out ideas of bringing quality equipment into your practice for the new year. And I want to take kind of macro concepts of technology that are present within operatories as well, like chairs perhaps, or maybe even lighting, and kind of talk a little bit about that, but more importantly, bring that down into micro concepts as we know a dental handpiece. So really it's about what we use, how we use it, and how we use it well. I literally am a comprehensive restorative dentist. I practice in the greater St. Louis area. I thank you for joining, and I also want to thank those who are possible for this program, and that is Dental East for helping make their commitment to education very available, as well as the support from Viva Learning. So they're terrific to work with and terrific to help push out information and great knowledge and products to us to help us practice better and learn more. For continuity purposes, there is a question and answer box. If you would please, if you do have a question, go ahead and type that in. And at the end of the program for continuity, I'm going to go ahead and answer those questions at the end of the program. So I'm going to kick off a little bit. I'm going to talk about consumers today because it's really interesting. This is a recent kind of just survey that was put out there with information that brought back what consumers are spending right now in our world. And if you look at this, and as you go down through the list with 121 billion on weight loss, 100 billion on hair care, et cetera, you go down to pet care, 50 billion, you go down to dental care, 50 billion. I have to wonder about how our patients, where are we putting our money at? Are we putting money in our mouth? Are our patients understanding that's really a huge value and tremendously important? Are we really educating like we should be? And it's never been a better time to be a dentist. We are definitely in the technology age. We have to be ready to answer to different types of I don't care if it's diagnostics, if it's different types of just introductions of education, how we inspire patients to move forward with their treatment, how we literally sign them up. I don't care if it's financial agreements, you name it all. We have the ability to do so much right now for our patients, but we've got to adopt the technology in order to do that and have the procedures in place to make that happen. But it's never been a better time to be a dentist. But along with that said, now we have patients who are not only consumers, but they're experts. And you've got to understand, you've got to answer to what they come in already thinking that they know. Maybe they've heard, maybe they've learned of, maybe they need a second opinion. And that's how you learn to wow a patient. Irregardless, dentistry finds us doing all kinds of things every day. I don't care if it's a crown prep, if it's an amalgam removal, if it's an access to an endo. We rely on precision and cutting performance of our handpieces. We have to know which burrs work best. We have to get the patients anesthetized comfortably. We have to make sure that they understand what kind of treatment we're promoting. We have to use the various tools that we have within our procedural toolkit, and we have to do that well. And there's a lot of demand to make that happen. There's a lot of communication that makes it happen. And what's interesting, visiting the dentist can be very uncanny for many patients, and many of them are very uneasy at this. I think the sooner that we can really calm their fears, that we can gain their trust and really improve how their comfort is, I think we can really gain them as a patient, because their loyalty will spread. They'll tell patients and friends and other people about you and your practice because they're comfortable. They understand that they can trust you, that you're using updated technology, and more importantly, that you really care about them because you're able to show, display, explain, and educate them why they need the care. But given all of this, 40% of dental patients peel away from your practice every year because they're looking for other means and other ways. So think about that. We've got to do better if you want to really keep your practice top notch and top shelf. So right now, with the amazing age of dentistry, it is definitely important. We know that patient comfort's critical, but more importantly, we've got to understand with all the innovations that we have to stay patient focused. And no matter what we do, no matter what kind of technology we use, we still have to have the patient in the center of what we do and make sure their comfort is good, make sure their experience is good. And that's really, really important. So I want to use this quote to really convey the true scarce commodity of the near future will be human attention. And I think that's so well said. It sums up and it says, hey, no matter how digital we are, we have to pay attention to human needs and what they are focusing on, and really to listen, to understand what they desire and what they care about. We have great diagnostics right now we can use. I don't care if you're using a CBCT. I have one in my practice. I got one about 2.5 years ago. Haven't looked back. Such a wonderful tool. Engagement, explaining to patients what's available. We can diagnose so much that I never even thought or knew was possible. And patients are confident with what they see and what they learn. And it's not as scary as what you might think too. Well, along with that education, we have intraoral cameras we're using now. We can set the stage. I don't care if there's a Pontic space or a primary tooth that just never, that came out, and we never had a permanent tooth that never developed. You set the stage for what that implant potential could be. So really using intraoral cameras now are so powerful, and we need to keep with that, along with how we show visually what is possible. Patients want to see this. Now, with all this vision that they're understanding and being literally stimulated by, you've got to understand that this educational approach is definitely going to convey loyalty and trust because they see what they're getting. But it also comes down to, guess what? The specifics of what we do day to day. We've got to have that attention to detail, to preparations, to equipment, to products that we use, and especially to hand pieces. And there's so many different cutting edge innovations right now that are out there. I want to really focus and literally drill down on about what features are current now for hand pieces, because as you power up your practice going into this year, you need to understand what is possible, because this field is really changing dramatically. And to keep patients comfortable, to get them to have the buy-in with all this great technology, it still comes down to that macro concept down to the micro concept of a handpiece in your hand. And the bottom line is 45% of your overall practice revenue right now is coming from single crown units. Now, that's an astounding number. I mean, that's almost half of your practice revenue. And when you think about that, really it affects not only the professional satisfaction you have of maybe doing a beautiful crown prep, but you've got this patient who's experiencing this tooth reduction. Maybe they're having a crown removal. Maybe they're having a new aesthetic case being treatment planned and then delivered and restored. The bottom line is, no matter what, this number is astounding, and you're using a handpiece each and every time. And you've got to use a handpiece. It is something that we use routinely and repetitively. So to really heighten why you need to have a good handpiece, I'm going to lean on some studies here. This is from the ADA Clinical Evaluators Panel Survey. And this was a study that was done. There were about 369 dentists. 53% of those who responded used an intraoral scanner. Now, 90% of those are using them for single crown scans. 70% purchased to improve a clinical efficiency within their own practice. Think about that. Now, 52% purchased a scanner to improve their lab communication, and 58% have owned them for less than 4 years. So the trend is definitely technology-wise for an intraoral scanner to be present within practices. Now, regardless if you're using an intraoral scanner or if you're doing traditional analog style impressions, what you need to come to understand is that when that impression is sent to the lab as an analog or traditional impression, it will probably most likely be scanned at your lab. And what you're going to understand is all that data is going to be taken in, scanned on a tabletop scanner. It's going to have a design that's going to be done by a technician, and then it's going to be milled And actually, I think some now around the corner, we're going to be looking at even printing. So that's going to come to the forefront next. And then finally, the restoration is completed, finished, and then delivered. So irregardless of what kind of technology you're using, and you think within your practice you're using traditional impressions, you are moving already into the digital realm by mere virtue of sending your impression to the lab. More studies to support why intraoral scanners are accurate and why they are used, because they work. And we're doing better and more improved dentistry now than ever. And this is critical to understand the relationship of technology with scanners and handpieces. I'm going to go further here. So here's a great study that was done by Schultze. They compared the time that was needed for adjustments of single posterior crowns that were fabricated by digital impressions compared with those of conventional impression techniques. And they went ahead and they took the study, and before cementation, they looked at the margins, they looked at the integular surfaces, the proximal contacts. Here's what they came to find out and to understand. They were looking at what was the time that was needed for all of these different various adjustments of the digital crown versus the analog type of crown that was made from that various structured impression. So here's what they came to learn. Bottom line is 22% time savings. So again, how does this relate, and how do we draw this back to our own practices? So I can tell you personally that I do use an intraoral scanner, and I have for now at least 10 years. I can also tell you that the time savings is real, but I also have to have a handpiece that can really deliver what I need to create as data that the intraoral scanner is going to make. So here's what I learned, and I come to understand there's definitely a time savings. More importantly, I know that time is money, and that's going to help my profit and my availability for my patients to be more patient-centric, to become real. And it also cuts down my chaos. It also cuts down literally any kind of qualms that I have, because sometimes I don't have to spend the time adjusting that crown. I have crowns that fit better. I have crowns that I don't have to do adjustments to. And if you have that situation right now, I really encourage you to look at scanners, look at your preparations, and look at what your handpieces are doing, because that might be something that you can tweak a little bit and make a huge difference. So let's talk a little bit about what I call prep school. And this is so important because here we have our handpieces. We know they are critical. And honestly, handpieces, they're the most frequently used piece of machinery in dentistry. They provide that necessary power of that rotary instrument to cut, to polish, to prep, to finalize that tooth structure of the dental materials, whether it's the ceramic or metal. They're vital for our success. So we have to have good handpieces. I've also practiced long enough that I've had handpieces that have given out, worn out. It usually happens at the worst and the wrong time. It happens in the middle of procedure. I've had things, the lights go out. I've had fiber optics just shoot craps. I've had things just literally just shut down. The turbine didn't work. I've had failures. I've had handpiece portions come apart. And with the rigors of sterilization, you have to think about what we're tasking our handpieces. So you've got to decide, hey, guess what? I want to have something that's quality, that's going to really help me perform at my best. What's interesting is drills and handpieces have really started back from 1870s. They were at 3,000 RPMs. And as they advanced through history, Dr. James Morrison really is the dental drill. And when you look at that turbine, that was really a wheel and a belt driven with a foot pedal. That's kind of scary. I don't know if I could have been a dentist back then. And then as you move into the 1950s, now we're looking at 6,500 RPMs. I mean, that's still a pretty good climb from there, double, but it really almost took 100 years to get to that point. And then you look at all of a sudden, 7 years later, now we've catapulted up to 250,000 RPMs. That's a massive amount of time. And with that jump in rotations, literally, it was a 90% reduction in the time of prepping a tooth. So that's a quantum leap in efficiency for dental practices. And literally, you look at this and you think about where this is gone, where it's going to. And now we're working with handpieces that in the 2020s, we're in 2020s, we're looking at 300,000 RPM. Some, go up to 450. We have an immense amount of rotation that can happen. And we've got better, stronger, more resilient, more durable handpieces to choose from. And as you look at this, you've got to understand the anatomy of a handpiece. I mean, obviously, you've got the head of the handpiece where the turbine sits. Often you have portals that have the light that comes out the water. You have the internal gears. You have fiber optics that are built into many of these now. They illuminate extremely well. And they have just components that really function. They can withstand the rigors of the sterilization process. And many of these have a friction grip type of a push button mechanism, depending on the model, which, and honestly, friction grip is the most popular. But one of the most recent innovations is now some of the sleeving of the handpieces, where many times stainless steel was used, and now titanium is really becoming the predominant metal, and it's allowed to make this handpiece about 40% lighter. So really, the anatomy has improved. It continues to improve. The technology within the handpieces is improving. So they're more durable. We can run them at higher speeds. They have more power. More importantly, better illumination, better water spray, and better hookups. Now, turbines have improved too. And for the longest time, turbines were really kind of a situation where if the turbine went out, the whole handpiece went down, and you just really were caught. And you have to understand that handpieces really are tasked every day, all the time. And those turbines are spinning at a high rate. So really, by sticking to a reputable company that has good warranties and good service, and honestly, for having a turbine that you can even change out within your own chairside practice, that to me is a very beneficial offering. So if you want to look for companies that offer that, I think that's a great caveat that you need to consider, because you just never know. If they have multiple handpieces and have a spare turbine or two, I think that's a good, wise choice. I do that within my practice as well. Now, also, all these different handpieces too have different types of connections and different types of coupling. And what you need to think about is quick connects. And if you're going to outfit your practice, your operatories with different handpieces, they've got to have fittings that can be quick connect, as you can see here on the left side. Other types of couplers offer situations where they have like an anti-retraction valve, where they're not going to allow the mechanism of backflow of water perhaps back into the dental unit. So again, that's a key component. Make sure that they have an anti-retraction valve built in. And you can see here on the top example with the 3 green O-rings, that is a great example of a different coupler connector that has that anti-retraction valve already built in. So again, make sure that your handpiece and the coupling system has that built in. You also need to think about swivels and how the cord is pulled, perhaps if it doesn't swivel, if it's just locked in, and that can have a different play on the balance of the handpiece as well. Pulling, perhaps even if the cord gets caught perhaps in the unit and jerks or something, that could cause a mishap with the patient. So you have to think about how these hook into the unit, how they're easy to take off and on, because they're going to be clean and sterilized. You have to make sure that your assistants know how to help maintain this and keep this clean as well. And for infection control purposes, you want to have the easiest system obviously possible and available. So what do you want to look for in a handpiece? And, as clinicians, we have to have the precision. We know that. And we want to be able to have something that can delicately remove a tooth structure. And I like to think of that a handpiece is often just like an artist brush. An artist uses different brushes to create different strokes. And we know that. But regardless, you've got to have a handpiece. It has to cut through that tooth structure, maybe that metal, maybe that amalgam. It has to be like a hot knife and butter. You want to be able to cut quickly without pressure, without heat, without vibration. And you've got to have a handpiece that can go throughout the rigors and the different structures, those two surfaces and different materials. So it's got to be easy and friendly. Just like all these brushes are easy to grab, we have to have handpieces that provide a variety of different strokes for us. So I don't care if it's virgin tooth removal, amalgam removal, margination, endodontic access, crown removal. I know the other day I had to remove a zirconia crown, and it's tough to cut through those. And the handpiece has to really lay in there, and I need to make sure the tooth is not overheating. I need to make sure that my hand doesn't get fatigued. That's another really critical element to consider as well. And finishing, polishing are more of the delicate types of tactile movements and sensations that we use with our hand pieces too. So we do something that really just can roar out of our hand in that high speed of 300,000 plus RPMs, all the way down to very maybe perhaps delicately polishing something, or perhaps even delicately removing decay. So we have a wide variety of what we need to feel and we need to tactily sense, and more importantly, what we need to really excel and really work with. So 3 key elements come to mind when you consider a handpiece. You need to think about the speed that the handpiece is going to move at. And that speed is like the RPMs that I was just talking about, okay? And a lot of the high speeds now can vary between 200,000, like I talked about earlier, and 400,000 RPMs. Another key element is going to be torque. And that is, in simple terms, basically the overall cutting efficiency of the handpiece. And then when you combine both the speed and the torque, you're going to get the overall power of the handpiece. Now, with that said, you've got to understand power really becomes a key element. This is measured in watts. And for instance, like an air-driven handpieces, it can range anywhere between 12 watts up to 18 watts of cutting power. So this is really going to be that accelerator that can really robustly remove a zirconia crown and keep spinning and allow that power to go through that burr tip, whatever you've chosen, to really remove that difficult or actually with a zirconia or even a metal crown. I'm going to show you a couple examples of this in just a little bit, but it really is a key factor and it's a differentiator. So you want to look for handpieces that offer a high wattage, because that's going to give you the power that you need now to really work through a lot of these ceramics and to remove them efficiently and effectively, because if not, you really can spend a long time trying to cut through some of these materials. Ergonomically, you want to look for a handpiece that has a nice head size to it. You're able to access those upper molars. The lower lingual aspects, sometimes even the buccal aspects, can be very tough to get to. I like to recommend that you have that key design element of a nice grip, because I think that tactility is better with some kind of striation on the handpiece, as you can feel it and sense it and rotate it. And if there's some little grip that's available there, I think you're able to just really feel tactily much better and sense things much easier as you're working on your restorations. More importantly, I think the angulation of the heads need to be in proportion to how the body style is. And you got to think also too about the balance of the handpiece, because it needs to rest in your hand properly. It needs to be able to swivel easily. Again, we go back to that quick connect and that cord connection, and how does that balance and how does that weight in your hand? Does it pull on your hand? And the nice thing about having something that really fits well in here, just like that paintbrush in the artist's hand, you have to think about that tactility and sensation that you have, and that balance, and that literally that pivot that you can move that head size and really operate and work well with. Ultimately, you want to have a very stable handpiece, and you don't want that handpiece to have any kind of wobble. The wobble not only within your hand, but the wobble also within the burr and the chuck, and how that comes out at the end point. You can think about hand sizes here, and I'm comparing a size 6 to a size 11 hand. So again, hand pieces, can vary. Hand sizes vary, but handpiece sizes really do not. So again, grip these, feel these in your hand, feel how they're weighted. I know that size 11 hand is going to be a lot different, and how that's going to balance and weight out versus a size 6. So those are just, again, considerations. And I think if you're really looking in the market for a new handpiece, it'd be good to have one brought into your practice. Let them allow you to try it out for a couple days, and really try to schedule a variety of procedures that you do within your practice, so that you can understand best what feels good, hook it up, work it, and run with it, and see how it does within your practice. Here's a nice example here, how I'm going to go up onto a second molar, and I can just feel how this works in my hand. And this is an Aries handpiece from Dentalese. This just works so nicely. It illuminates extremely well. I can just reach those posterior molars nicely. And I can really just, I don't have any kind of pull from the cord. I just feel that I have nice gripping to this. Those little ridges that are placed there on the handpiece, you can see really help me just to kind of maneuver that, and my tactility of the handpiece and how I meet the tooth really just provides, I think, a very good feel and a very good fit. And I like the design of this handpiece. I do use it a lot. I like how it has a 22-degree angle on it. So that allows a proper, really for the operator, a great visualization that you can see for really any procedure that you're going to do. So this is a handpiece that I use and I task with daily. I work with it daily, and I have really, I feel very excellent results with it, and putting it through lots of rigors, lots of crowns, lots of amalgam removers, etc. Fiber optics is another thing you need to look at. And I think it's so important to have really, really solid illumination that doesn't get clogged or doesn't fog, which is another important element, and to really have something that helps to reduce eye fatigue. So that's a very important element to understand. So a really good fiber optics illumination factor is so very important. Some of the newest innovations right now, we're using LED light bulbs, and they tend to be a lot brighter. So again, look for a handpiece that has an LED offering light bulb. That's very, very important. I think too, a lot of times when you're, say, like if you're going to go to a dental show, a trade show, perhaps, often you're not really allowed to run the handpiece with water. Often you really can't even see the illumination. That's why I recommend having them bring that into your practice and allowing you to use that clinically. I think that's so important, but you need to really gauge how much water spray comes out of those handpieces too. So if you're on the showroom floor and you're looking at handpieces, you need to really understand you've got to run that with water so you can get that water spray out of there to really see how much water spray is coming out of there and how much illumination is coming out with that water spray, so you can get a better gauge and a better measure of how that handpiece performs and what it's going to do for you in your hands. More to that point, here's the illumination again of that Aries handpiece, and you can see here how brightly that shines up in that second posterior maxillary molar. I mean, this is amazing. That's a really difficult area to see. So I'm able to marginate so much better. I don't have to worry. I personally have operatory lights. I don't wear a headlight on my loops, but we all need to see better, and we can marginate better. We can work faster if we can see, and something's more brightly illuminated. So these are really important elements to really see and to understand how important clinically they bring forward for us more efficiency, more procedural efficiency as well. More to the point on water delivery, we talk about the fiber optics, but water delivery is really critical as well. Look at handpieces that have obviously more exit of water spray. And many of these handpieces have spray that comes out in different formats. Some have a single port, others have multiple ports. Irregardless, the port spray needs to have a very good air cooling going through it and blowing through it to be able to take the water onto that preparation to clear the debris, and more importantly, to actually cool down the handpiece, because these can get very, very warm. More importantly, the burrs get really warm. So you've got to have a handpiece that really can perform when it's drilling, when it's spinning. The water delivery is clearing and making sure that you have good illumination and good clearing from the spray. So here again, I like that Aries handpiece because now this has not only one optic port, but it has two optic ports. So that's why it illuminates so nicely and so brightly. But it also offers 3 ports of water spray here, and you can see those ports right there around that handpiece head. So I think this is an excellent choice because it illuminates and sprays and clears the working field that you're on. Another thing too about that anti-retraction technology, I talked about and I mentioned earlier about having something that does not have the ability, but for patient safety, which we're more mindful now of more than ever, you have to make sure that you don't have any of that backflow that can go into the dental unit. And I personally have dedicated water lines for every operatory that I have. And I have to make sure that those are clean. Those lines are just totally well taken care of. I don't want to have any introduction of bacteria that could literally retract back into that dental handpiece, which ultimately could go back into the water flow and water lines that I have as a mainstay within each operatory. So it's critical to understand what kind of features, additive features are on these handpieces to make sure and ensure that they don't allow any backflow into the water line. So that is a question you need to ask and need to make sure, because obviously we're making sure that patient safety is first and foremost. Now I want to shift a little gear bit and literally talk about different preparations and pitfalls of preparations, because our handpieces are a big portion of this. So one of the largest, I think, pitfalls that we'll find and learn about is the factor that, and if you talk to most labs, they'll all tell you that occlusal reduction is probably the #1 pitfall. And specifically, it was never measured correctly. And you can see here, this is a great example of a zirconia crown that was lightly adjusted and then wore through. And because of that improper reduction, the crown had to be redone. So labs are seeing this all the time. Now, the beautiful thing is if you're using an intraoral scanner, guess what? You can overcome a lot of this because you're able to see specifically how much reduction you have on that preparation. So again, related back to your handpiece and doing a quality preparation, you can be a lot more accurate, a lot more specific because you're using those types of technologies. When you're doing your digital preparations too, make sure you don't have sharp line angles. You need to have more smooth and more rounded type of transitions, because they're going to be healthier for that restoration, healthier for the tooth, less chance of fracture. And again, this is one of my early failures because I had a sharp transition. I had a molar crown that literally broke right in two. That was my failure of not understanding what I needed to have preparation wise. So smooth transitions and rounded transitions, no sharp angles. Another thing you need to make sure you don't have any types of undercuts whatsoever. And you can see here in this example from a lab, this preparation, the dentist even marked their margins. You can see they're poorly marked. They're actually poorly delineated as well. But the bottom line is there's a lot of failure here. This preparation is going to be doomed from the start. There's undercuts here. You have a jagged area here in which a milling machine cannot even mill that restoration. And this is something that typically could be sent into the lab to have them fabricate. And literally, I think if a good handpiece could have worked with this and a good and properly selected burrs, I think this could have been a more properly done preparation and really have moved forward from what you're going to see there, which is going to fail. Again, lack of margin clarity. Again, if you have a good handpiece and you have the proper burrs and great illumination and water spray, it's going to be a lot easier to mark your margins. And I know we work in a tough environment often. You know, you've got gum tissue, you've got hemorrhaging, you've got debris, you've got patients who don't open, you've got the thing called the tongue. We have to work around a lot of elements, but if you have a good handpiece and a good burr, I think you're able to do a lot easier dentistry and better dentistry because of that reason. So just to kind of recap, design principles for ceramics and digital type preparations, you need to make sure you have that adequate thickness. You want to round all of the internal line angles, smooth transitions everywhere, and just have nice internal features that flow and no sharpness whatsoever. That's a very important element to understand. So there's some of that rounded preparation that we talk about. Again, doesn't put the stresses or forces or the potential fracture lines or fault lines within that ceramics that you're going to restore at the end and deliver. So ideally on zirconia reduction, I know that we talk about this often, but again, use your burrs as a measuring tool, use a good handpiece so that you could accurately cut through the tooth surface and structure and achieve these proper reduction depths to ensure that you're going to have a very good product at the end. So zirconia reduction, you're going to have a 1.5 millimeter to 2 millimeter depth on the occlusal table that you're going to reduce. Facially or buccally, you're going to look at 1 millimeter to 1.5 millimeter of reduction, and the proper taper is going to be a 5 degree to 15 degree taper. And this is proper for milling, proper for what that lab bench scanner is going to take off of that analog or traditional style, conventional style impression that you also send to your lab as well. So more onto that point of zirconia margination, it's really critical to understand that for margins and for the milling, you've got to have a margin that is 1 to 1.5 millimeters of an angled delineation. And that is critical for that optical scanner or a intraoral scanner that we use chairside to pick up on that preparation. So very important to have that type of design and delineation for your margin. That will produce successful results for you on your your restorations here. More to the point of defining that margin to really create that clinically, again, you've got a robust handpiece that has good wattage. It's going to deliver the power that you need to spin that burr. Modified shoulders are pretty well the routine now. I think within most ceramics that we're delivering, you want to be able to create a margin that's very smooth and very well defined. You want to, as a handpiece is spinning, you can see here the green arrow as it's going counterclockwise around. You're going to move counterclockwise as the burr is spinning clockwise around and it's rotating. So you're kind of pulling against the tooth. And I think this is a very good way to control how to create a margin. I think you can have a really excellent tactility as you move around the tooth in this fashion. And I think you'll find that you can create margins a lot simpler and easier, and you can go back over them and smooth them as necessary with this methodology of approaching a tooth and defining the margin as such. So if you're not doing this, I really suggest that you try to do this. I think after about maybe two crown preps, you'll realize real quickly how your handpiece feels, more importantly, how that burr feels in there and how you're moving around the tooth to create that margin in that fashion. Now, what do you want to avoid on margins? Because it's very critical. I mean, again, we're relying on our handpieces. We're relying on that tactility. And if you're using a handpiece that doesn't have that feel and giving you that feel back to you, you're going to have a problem because you're going to have different situations where perhaps the burr is really maybe worn off some of the diamonds. Sometimes you create edging or ledging or hooking on the margins. And if that happens, this is really tough because the scanner will not be able to pick this up adequately. More importantly, the milling machine will not be able to mill that J hook, and then you're going to have a restoration that will not fit at its final seating. So this is really, really important to avoid that. So again, these are all the types of different margin catastrophes that can happen. And I do relate a lot of this to a handpiece because you've got to be able to feel that. You've got to be able to see it. You've got to be able to use good burrs that don't allow you to even go to that level of problem which you could create. So again, these are all different presentations you want to avoid, especially for digital preparations, which again relates back to your handpiece and good burr choices. Now, another thing that you want to make sure that you do is your preparations, especially today, more than ever, need to be smooth. So as you're getting ready to do your final impression, whether it's a scan or a traditional conventional impression, you need to make sure you smooth your preparations. And this is really important. You can do this through using a fine or a super fine diamond. You can use white stones. I like to use those often as well. But you slow your handpiece down. You can use even a slow handpiece to do this. But it's really important to have smooth preparations. And you say, well, why is this? So here's what we've come to understand. As we're using all these different and various now adhesive cements to place these restorations, that we've found and understand now through many studies that the results showed better bond strengths to finely prepared tooth structure versus coarse diamonds. Now, I've been practicing long enough to always think and thought that if you had a rougher surface, you had more surface area, therefore you're creating more retention. That's not the case here. And we have another study here I can prove and show you that again, another great study that shows results of the bond strengths of finely prepared tooth structure versus coarse diamonds were better. So the thinking is that if you have a smoother surface now, the ability to have the adhesion rise up and really to it can flow in a more even space and an even surface that is a better methodology in which now you can bond and adhesively place your final restorations. And this is one element I think you can tweak. And again, it relates back to that handpiece. So take the time, take the extra step, smooth your preparations, use a great handpiece to make that happen. And you're going to get, I think, a better result. All right, let's talk a little bit about clinical use of your handpieces and just run through some cases here. These are routine units that I do within my practice. These are the routine burrs that I use. I really believe in using a one and done burr, single use burr. I believe that's a mainstay, especially in today's realm of patient safety, practice safety. You can see exactly what I use here for my preparations. I really don't vary from this. It's very simple, easy, very straightforward, but get great results from this as well. I find too that I think if you have a really standard procedure for your assistants to set up, it's just, you don't need to have 30 things to do the job that 3 or 4 burrs can do. And you can see here exactly, again, same results. But here, what I'm going to relate to is if I have a good handpiece, I know that the patient's going to be comfortable. I've got the cutting efficiency, and my burrs are going to really provide that precision along with the power from that handpiece will create that accuracy for me for that ultimate restoration that I'm going to place. So it's important to really make sure that your handpiece is performing well and it's robust, so you can really move through two structure carefully and quickly and precisely, because that's going to give you and yield a better result at the end point. So multiple unit dentistry, again, is when we're removing amalgams, whether we're doing multiple crown preparations. I mean, we're tasking our handpieces to do a lot of cutting, a lot of different materials. You want to make sure that, again, your handpiece doesn't, you want to reduce any kind of, long-term injury. You want to have that feel in your hand, and you don't want to have to put a lot of pressure. You, again, have a handpiece that can really cut and has that power behind it to make your job easier and ultimately make it better for the patient too. And the patients do notice these things. So on traditional, like for me, zirconia or glass ceramics, on multiple preparations, here's my standard armamentarium of the burrs that I use, along with the Durastone again, that I'm going to smooth that preparation. Now in this kind of situation, I'm going to go ahead and use, sometimes I use burrs that are designated for multiple preparations, and I just kind of find that that's a good and wise choice. And then I go ahead and move through that two-surface and structure, prep correctly, and then I'm going to throw those burrs away after that procedure is done. So you can see a case here that has a pretty big involvement here of a lot of preparations, very comprehensive restorative case. As an operator, I have to have a handpiece that really meets the clinical demands of this. I mean, I have to make sure that I can move through the two structure, variety of materials. I have buildups I'm going to be doing on this amalgam. I'm going to be removing precision that I have to do, but it's got to allow me to be able to feel what I'm doing, and it's going to allow me to create a smooth preparation and really reduce any kind of fatigue. And when you're prepping multiple teeth, often you do get tired. You have eye fatigue, you get hand fatigue, but if you're using good tools and good technology, really it can help reduce that possibility. You can see here more of the reasons why I choose a handpiece that has good power. This is the Aries again, the 500 here. There's also 400. What I'm going to tell you right now, this is the leader in power with handpieces right now. It offers 39 watts. So this is the most powerful handpiece right now. You can get air-driven handpiece on the market today. I think it's a really great choice because the illumination, the port water spray that you saw earlier of the 3 ports, I think between the power, the water spray, the balance, I think I absolutely reduce my hand fatigue by using this on larger cases like I just showed you. And I want to make sure that it performs correctly, it performs safely, and I can literally have preparations that are well defined, given whatever materials, buildups, whatever else I'm removing. But you can see here my intraoral scan, and you can see the preparations of multiple units here. And I think this allows me to do the level of dentistry and deliver the amount of care that I want to safely and effectively for patients. Here's one of my operatories. You can see here what I'm using, how I feel just the comfort of this wonderful, this is a Forest delivery unit. I have 3 operatories within my practice. I can tell you that patient comfort for us is foremost. We want to have, especially when you're doing, longer types of procedures, you want to have headrests that articulate nicely and easily. You want to have comfort for the patients so that when they're in that chair, they have good lumbar support. Their legs are in a proper relation to their heart and their position. I think, to me, this is just a really good care, good, thoughtful, just encompassing patient experience. So I think to move into nice, comfortable chairs, and these are very, very excellent additions. If you're looking at any type of this equipment for the new year, again, put that on your to-do list, your wish list, your goals. I think this is something you need to look at, because I think you won't look back. This is amazing, and patients really do sense it because they can tell the difference between your practice and maybe the other practices that they were at. So they're going to stick with you. Here's that final case here. You can see how that turned out, and that patient was thrilled. Another demanding case here is you're cutting through metal, and these PFMs, this is a challenging case, because one of the first things that for me comes to mind, obviously we need to have better margins on this, but you certainly don't want to have a handpiece that really stalls on you, or more importantly, is not concentric, or it has a kind of a jumping or a wobble to it, because the margin that you think you're going to repair now might completely be different because your handpiece doesn't perform at the level that you need it to make sure that you don't really gouge anything and you don't create more of a problem to redo a margin than where you want to place it. So you can see here, cutting through this is really critical, and this has to be detailed. You have to have a handpiece that really has great power. Again, I can tell you right now, I'm cutting through a lot of thick metal on this PFM. Porcelain fused metal crowns, crown and crowns. One had a pretty serious post-import buildup going through these materials. This is tough stuff, and this can create a lot of hand fatigue if you're really not using, again, proper handpiece and the right burrs. Again, good choice on burrs makes a big difference as well. Good illumination certainly helps, but I'm going to rely on something that really provides a great result. And for me, that's going to be, again, that Aries, that Star handpiece. You can see here, this is really interesting because they're a leader not only in the power aspect, which to me is very important, but they also now are offering what they call RFID technology, which is a radio frequency technology that literally lets the handpieces tell you exactly where they are within your practice, what they're doing, when they last visited the autoclave. And this is interesting because this is a very unique feature in that it really is going to start reducing the burden on your office team members by automating and tracking and offering record keeping for you. So I think this is a really great advantage on some kind of product line like this. So again, looking at handpieces, thinking about precision, thinking about all what we do clinically is one aspect, but then you look at the practice management side of this and you think about yourself. When was the last time? When was this handpiece serviced? When was this maintained? This is a system now that is really provided, and it's helping you to help your assistants keep everything managed correctly, properly, and timely. Here's those preparations. You can see here, I do not have gouged margins on this, and I was very happy with that result, and so was the patient too. So again, tough to take off 2 old PFMs that were on there actually for 27 years, which is pretty amazing. But again, zirconia removal, we have to really have a robust handpiece and powered up handpiece to make that happen. It's a challenge to cut through some of these materials, and the stakes raised because if you're working on that anterior segments, you don't want to lower those margins too much, or you're going to have some problems with that. So critical. Endo access. I love now that we have burrs specific for this, but more importantly, you have a handpiece that robustly can manage this. You're all the better for that as well, to really be conservative and really minimize any kind of discomfort for your patient too. So I want to spend a little time about how to optimize your handpiece, because there's some tricks here that I've come to learn that I want to share with you so that you understand how important this is and how simple this can be and really lengthen the life of your handpiece. So concentricity really is defined as the ability of the handpiece to produce a consistent cut line with the diameter of that burr. So you can see the example here on the left. It's not very concentric. It is vibrating. It is not going to be the type of cutting vibration motion that you want for your handpiece. Now, the example on the right, that is a concentric burr and a concentric type of handpiece that is going to offer it a good performance. It's not going to have the perceptible vibration. The patient won't feel that. It'll be more comfortable. And honestly, sometimes if you're able to see any kind of concentricity with it's visible to your eye, what do you think it's doing to your preparations? And then I'm going to relate all this back to what a digital preparation requires and the accuracies needed now for all this milling. And I can tell you, this all plays out. You're going to have a better end product if you have a handpiece that performs and the turbine is spinning and the power is correct, and you have complete, literally, just good. You have a system that's working. They all work hand in hand together. So again, look at a handpiece and how it has this ability to spin correctly on the focal point, and that's really what you need to come to understand. Another thing to really extend the life. Often we blame our turbines, thinking that they're wrong, they're off, they're worn, they're wearing out, they're fatiguing, when in actuality, it's really a burr. So I'm going to really encourage you to use fresh burrs. I'm going to encourage you to use a one and done burr on single crown preps on various different procedures. And you can see here the picture on the top right, you can see here how that burr has worn off diamonds and debris and clogging. That's going to really produce very, very non-efficient cutting. And what ultimately happens is we're blaming our handpiece and the burr. Now, with that said, then now you're looking at downtime and you think that now you need a turbine, your handpiece is going awry. Well, guess what? Really, probably it was just the burr to begin with. So you need to think about that. Also think about the convenience of having the ability to change out your turbine chair side within your own office. And that's a big thing too. Another thing to think about is what kind of process do you need to have with your handpiece? Does it need to be lubed, and does it need to have proper lubrication after how many cycles? Or do you get a handpiece that is lubrication free? Personally, I like the lube free because then we don't have to worry about it. And that's kind of my tendency and my gravitation. When you want to extend the life of that handpiece, again, don't use dull diamonds. They're going to chatter, they're going to vibrate. The patient feels that. It's going to ultimately wear down the turbines quicker. Always use sharp burrs. It's going to be much better design, cutting efficiency, better chance of just a ultimately better product, going to reduce your hand fatigue as well. Another thing on extending that handpiece life, make sure that you have the proper air pressure. And often when these are installed, they're using different gauges to make sure the air pressure is coming through these lines properly. But get this checked out again once a year. Make sure the pressures are correct, because if it's the improper pressure, it can underscore or overtax that turbine, and you're not getting the results that you need to really maintain that properly. Another thing to make sure to keep your handpiece life going, turn your water up. Again, that's going to reduce that clogging like I talked about. It's going to lubricate that preparation and the cutting process, and it's going to make that burr cut better and easier. And obviously, it's going to reduce any kind of post-operative sensitivity. So less irrigation is going to create heat. You've got to use more water. Turn the water up. And here's what we know. Patients definitely will sense this, and they will know for sure that something's vibrating, and that will lead to heat buildup, and that's different. That's just, you can avoid all of that. Make sure that you just do that. Honestly, sometimes it could take 2 weeks up to 6 months to just really resolve any pulpal sequelae. So you need to make sure you have that water turned up. You don't want to have that vibration. Have a good handpiece, good burr, concentric handpiece that runs and performs correctly. So how long does a handpiece last? What's interesting is most handpieces last around a year. Now, with that said, that's going to be basically a turbine. And this is generated from a lot of studies that we've done, about 500 to 539 cycles. So that's a pretty good barometer. And some of that information comes from CRA's newsletter and different surveys and different sterilization cycles. So basically, it's based on cycles. Okay, so after procedures and cycles, one handpiece, you're looking right around basically 500 cycles a year. Now, what's interesting is I want to bring up the factor that back in the 1990s, the FDA began issuing guidelines mandating routine sterilization of handpieces. Now, I know that we all want to hold down our costs. I know that we want to have, and handpieces can be very expensive. Here's what I've come to learn. You need to clean and heat sterilize your handpiece. And you need to make sure that you have the air lines and the water lines clean. And there's never been more important time now to do that than ever now. So have multiple handpieces, have economical handpieces that offer the value. And I think some of the choices that you see when I'm using and displaying clinically can work and work well within your practice, and they're good choices. Again, keeping that handpiece maintained well, always make sure that you're wiping it down, always perform a 30-second flush, dry the handpiece, lubricate it, run the handpiece, and bag and sterilize it correctly. Now, what I would also recommend too is a lot of times to put the chuck after you've run the handpiece, after you've lubricated, put the chuck in there and go ahead and put that chuck in the bag, again, in the handpiece, engage it, and then sterilize it. And then when you bring it out, run the chuck with it, and then you're ready to go ahead and start your procedure. So every week you've got to think about what you're doing, how you're going about this, making sure that your assistants or whoever else is responsible for your maintenance, your handpieces, they understand protocols and they absolutely understand what is necessary to keep these handpieces at their optimal performance. So very important on all those aspects. I'm going to leave you with a couple of thoughts here. Only you have the power to determine whether your future mimics your past. And I think it's so important that we learn and we continually practice and we get better and we take different tidbits of here and there, little pearls, and we put that all together and really provide, I think, just exceptional care. And we really benefit with technology and especially with our handpiece choices and other things that we just deliver, I think, great patient experience. So with that said, I'd like to thank you. And more importantly, I'd like to let you know that there will be continuing education offered at the end of the queue here. And you can go ahead and go through that queue to go through that. I'm going to answer a couple questions, and I hope that you have a great rest of the day. I wish you a happy new year, but let me get to a few questions here. First question from Patrick is, are you using the Whitestone Bird at slower RPM? Yes, I am. You're suggesting, Patrick, that I'm using this around 40,000 RPMs. Yes, I am. I feel that that really has a good control. Sometimes I even dial that down even to 20,000 RPMs. I like the Dura White from Shofu, and I think that works very, very well. Next question from Christy, how much are the handpieces? Honestly, I don't know, because a lot of times I will bundle them or wait till they kind of come into a sale. And sometimes they offer you good situations and offers like that. So I think that's what you need to do is reach out, see what they have available and see what kind of situation and how they can bundle that together for you in your practice and how you need to hook everything up into your practice. So I think that's a great question to ask them and see how they'll work with you. And I think that's a really important element, I think, here to work with and work with your reps and work with your service people as well too. Great question here. What are your suggestions on the best types or brands of burrs that you use to cut off zirconia crowns with? I think there's some great burrs that are on the market today. I personally like some of the microcopy burrs. They have a Z class of cutters that remove zirconia extremely well. And I think that works very, very nicely. So I think that helps tremendously. So I think, again, the right tools in your hands, it's a lot easier job and a lot more efficient. So with that said, I want to thank everyone. And I'm going to pass it over. If you would like to get hold of me, you can. So you can see where I can be reached at here, and have a great rest of the day.